Hello and welcome to Healthcare Simulation Week. I hope you all have plans to celebrate Healthcare Simulation Week. Thanks for joining today's webinar titled Striving for Excellence when Starting a Simulation Program. My name is Asit Misra and I will be facilitating today's webinar. I work as Assistant Director of Pre-Hospital and Emergency Training Division of the Gordon Center and Assistant Professor of Department of Surgery, Division of Emergency Medicine at the University of Miami Miller School of Medicine. Please allow me to introduce you to the speaker of today's webinar, Dr. Sujatha Thyagarajan. Dr. Thyagarajan is the lead pediatric and pediatric intensive care unit consultant at Esther RV Hospital, Bangalore, India. She is also the founder member, past president, and current secretary of PediSTARS India. Her special interests are in in situ simulation, low-cost methods of simulation, hackathon, simulathon, trauma, and faculty development. She has been the core faculty and mentor for all national workshops in simulation offered via PediSTARS. She has been an invited speaker in simulation for national and international conferences and also contributed to the development of pediatric trauma services in London, including development of massive transfusion policy. Thank you, Dr. Thyagarajan, for being the presenter for the webinar today.
Greetings from PediSTARS India. I'm Dr. Sujatha Thyagarajan. I'm one of the founder members of PediSTARS India and the current secretary. I'm also a lead pediatric intensivist based at Asit RV Hospital in Bangalore. I'm presenting on behalf of PediSTARS India, and I thank SSH for giving us this opportunity to share our journey of PediSTARS in India over the last 9 years. And the theme that was given to us is striving for excellence when starting a simulation program. So let me take you all on a flashback to a decade ago, how the progress of simulation was in India. So these were some of the things that we were being told. So what's simulation? Did you say stimulation? Are you saying we need to learn from mannequins? Why do we need mannequins? They're so expensive. This is India. We have real patients and we can learn from them here. And why do we need to waste our clinical time doing simulation, especially in the hospitals? And what about errors? Well, they're just a matter of really bad luck. So this was our scenario when we kind of proposed the thoughts for simulation in India. I'm sure many of you resonate with this, especially the countries where simulation-based training is still yet to start its roots. It's just a reminder for all of you who's about to start a program to just think about how to kind of get there. So we started by building the evidence for simulation-based training. So my colleagues, Dr. Rakshay and Dr. Gitanjali, conducted India's first pediatric simulation workshop in Hyderabad as part of the Pediatric Medical Care Congress that we annually have. And during their experience when they conducted, they found that it was very, very difficult to get trainees to register. And we shared our experience as part of a poster that we submitted in International Pediatric Simulation Society workshop. I was working in Bangalore and I submitted a couple of posters of my experience of even working with a pillow because my hospital did not have mannequins. And needless to say, they found that it was difficult to accept without any realism there. And also we had, but they did understand the concept of simulation and they said scenario-based training, the residents rated them quite highly. We networked with various international agencies, and in 2013, we decided to form the society called PediSTARS India. This was, which is called Pediatric Simulation Training and Research Society of India. Started as a self-funded society by just the three of us, my colleague, there's Dr. Rakshay, Dr. Gitanjali, and then myself. And we were able to garner global support within the year. How did we do? In collaboration with international societies through affiliations and agreements, SSH, IPSS, and Inspire. We thank Dr. Vinay Nadkarni to be the link for all of these agencies. Now that we formed the society, our next move was how to build this national momentum. We are just doing simulation in our center. Can we collaborate better and make it pan-India? That was our vision and dream. That's how we started in 2013. How did we do? We started countrywide workshops for emergency care. We focused on that. So we did more like targeted workshops. We innovated and had single day workshops such as STEP, Museum, Success, the various boot camps, SNAP workshop for nurses. Our lifeline is faculty development program, making sure that we have an adequate pool of simulation facilitators to facilitate these programs across the country. We have a simulathon, which is thematically based like a marathon of simulation across the country. And then we have our own annual conference, and we recently concluded our Simulus 7 at AIMS Jodhpur. We have community-based simulation programs as well, which is called the ABC Active Bleeding Control Stop the Bleed program. And we continue with our collaborative research and low-cost innovation hackathon programs. Let me just tell you a little bit details about our key milestones. So we started with propagating across the nation first. So we had a national outreach through various of our workshops. And recently we've started having global outreach, more of an international representation, more of research, which is multi-center. And I'm very pleased to say that PediSTARS members have started giving awards across international conferences. We have not stopped ourselves innovating even in telesimulation. We've recently formed a nursing special interest group, and we're scaling up our community ABC Stop the Bleed program. These are our activities across the decade, and we're very pleased to say we've conducted more than 115 workshops across the country, and we've managed to reach nearly 10,000 nurses and healthcare professionals. We started with 3 people, and now we have times 5, that is 15 board of directors across to manage the administrative functions of PediSTARS India and to form various special interest groups to help grow simulation across India. And we are very, very indebted and have immense gratitude to our international mentors. How did we do that? Without funds, without resources, and without even simulation labs. We did not spare any opportunity to reach whoever was interested in simulation in whichever place they were and however we can do it. It was just the sheer determination to make it happen. And we didn't spare any space, including hotel auditoriums as well. And our lifeline faculty development program, let me tell you very clearly, to spread simulation, we need faculty. It's not possible to have a small core team to spread simulation across the country. So we were very lucky to have our international mentors who spared their time, their resources, their funds, come visit us every year and help us reach out and train the faculty. So we are very, very lucky that way. Our faculty development program has happened and evolved in collaboration with Children's Hospital of Philadelphia, Boston Children's Hospital, Starship Hospital in New Zealand. And we had a very good buy-in from our senior educators across the country. We now have trained faculty who have joined the National Pool of Simulation Facilitators, and they are helping us to disseminate the SIM programs. Let me tell you a little bit about our three-tiered faculty development group. The structure in level 1, it's a 2-day workshop where there is a hands-on experience of getting to know the nuts and bolts of simulation. And it's a 2-day hands-on intense workshop with an attendance and a certificate. In level 2, over the next 6 months, they need to go back to their own workplace, and we share with them standardized scenarios that they are supposed to conduct in their workplace, and then get reflections and debriefing done with their own assigned mentors. Please remember, this is like open to the PediSTARS members, and all the mentors work for free. And in the next 6 months, we have 3 projects in the level 3, based emphasizing mainly on the research aspect of it and their own conduct of simulation. And this is also, once again, reflections, debriefing, and portfolio done with the mentors. Our PediSTARS workshops have been very popular over the last few years, and you can see the growth. Nearly 80 participants every year get trained, and our nursing in numbers have also started increasing. Let me tell you a little bit about the simulathons, the period prevalence across the nation that we conduct. We've had various themes, as you can see, mainly on resuscitation, trauma, sepsis, communication training, telesimulation, and last year on COVID-19 preparedness in 2020. About a little bit on how do we do our simulathon. So the core team does the needs assessment and picks up a theme, creates scenarios, identify all the facilitators, then we prepare them through our WhatsApp group. We share various ideas on how to actually conduct this simulathon, and then we do the running of the scenarios. We share the summaries in the WhatsApp group about our learning points, identify those system changes, which is fed back to the core team to deliberate on how to make things better. So this is our preparation of simulation, and then conducting the simulation, and then collecting the system changes, posting, and our experience of reaching out to as many as possible. Over the last year, we've been starting to work with our nursing leadership because they are key providing that care for the children. And our joint secretary right now for PediSTARS, Ms. Sujatha Das, has been awarded the scholarship, which is the PediSTARS Sejal Dilip Kulkarni Nursing Scholarship for the last year, and to get CHSE SSH membership as well. So we thank Pooja Nawate for helping us with this. Our ABC Stop the Bleed program is a collaborative effort with various agencies, including CHOP, where volunteers are trained to provide the care, stopping the bleed. And in September 2021, we launched it even for the schools. How do we build the momentum otherwise? More so, creating stakeholders' awareness in journals, textbooks, and magazines, through symposiums, and through international representations. I'm very pleased to say that our telesim project has actually started reaching that child as well, and we have demonstrated the improvement in the care given to children with sepsis through our award-winning project from CMC Vellore. Our PediSTARS telesimulation journey during the COVID time has been immense to reach the unreached. We have turned this adversity into an opportunity through collaboration and through creative innovation and through community building. All our work has recently been recognized across the world. We started with our SSH President's Award in 2018 to actually winning the Inspire Research Award in 2019 and 20. We won the Cornell International Telesim Conference Award and the best presentation in the IPSS as well this year. Our work continues. The future, what can we do better? It's important to sustain partnerships and collaborations across simulation societies in India, various professional bodies, learn from each other, have roundtable meetings wherever possible, and work with our agencies to get formal accreditation. Our journey for striving for excellence continues, and I'll be very happy to take any questions. Thank you so much for the opportunity to share our journey. And I hope it inspires many countries that are willing to set up another PediSTARS in their own country. Thank you so much.
Thank you, Dr. Sujatha. At this point, we are open to take any questions from the audience. And you can also type your question in the chat box. Okay, Dr. Sujatha, while we are waiting for questions, I have a few questions for you. So tell me a little bit more about what were the challenges when you decided to to start simulation program in India, and also what inspired you to start this excellent simulation program in PediSTARS?
Thanks, Dr. Asit. So the first real challenge, like any other country and any of us, funds. Funds is a major constraint. Okay, but I think most importantly, the thing to break that barrier is basically just the willingness to make sure that nothing stops. And with whatever resources you have, you innovate and you make sure that it reaches to that patient. The need for it is definitely there. Okay, we have the culture of starting caring for patients, but how safely do we care? How do we ensure psychological safety for the learners and also make sure that patients are not at risk? That is a key motivation to start the program. It didn't matter whether resources were there or not. The real key was to network, bring the like-minded people together. There's been lots and lots and lots of hours of, commitment, which was needed, and constant motivation. Our international networking has significantly helped. We're very grateful to SSH, IPSS, Inspire, who have helped us kind of give us that structure, the affiliations and the support as and when. Every year through our healthcare simulation week, we've managed to reach many in India thematically, through our simulathons.
Thank you. Thank you. I see a question in the chat box where they're asking about is there a community for accreditation? So is there any community which helps people who, I think I understand this way, who wants to get accreditation? I am pretty sure there's something in if you're a SSIH member and you go to SimConnect, there might be a few communities there which can help to talk about accreditation or any questions related to accreditation. So that's there. So another question I have was, Is PediSTARS restricted to pediatric simulation or the scope is out of pediatric simulation?
Quite interesting, actually. We started as for pediatrics, and then we are now having it almost for everybody across the specialties.
Okay.
It's for everyone now. So we've had anesthetists, we've had nursing from various different backgrounds of nursing, as well as anesthesia, surgery, orthopedics, obstetrics. Everybody is like very keen to join us for our faculty development program.
Good. I see another question, I think from Ethiopia, and someone wants to start a simulation program with limited resources. And then the question is how to create local awareness about simulation. If you can share your experiences of awareness, how you did that.
That's quite a good question there. So the first thing would be to make sure that you in various national or international national conferences or local meetings that you have, even within the hospital as well, trying to kind of share pictures, making sure you kind of show them how you are conducting simulation locally. That kind of brings them to find out, just generates some curiosity as to what is going on, and then you have a conversation, you build a narrative, you say, okay, there's one person interested, then the next person. If there is a possibility now that it is a virtual world, you could connect with various people across the world so that you can conduct some programs locally. So we last year helped out Pakistan team in Aga Khan, Karachi, where they were able to conduct a simulation boot camp for their trainees, and we virtually supported them as faculty. We also had like a quick kind of faculty development program for them so that they also knew what to anticipate. So it's like empowering the local community. So there are various options to build that awareness. So these are my suggestions.
So I just ask you a little bit more on that. So how much engagement you saw in Indian hospitals when you started this awareness simulation back in India, and has social media helped you to build nationwide engagement? Is there any role of social media to spread awareness about simulation? What are your experiences?
Absolutely. Initially, when we started, people hardly knew about simulation-based training. What we knew was the PALS and NALS that used to be very particular, because most of the hospitals have it as a requirement, okay, to have to have all their staff trained for PALS, NALS. That was their basic requirement. So they had the mannequins, but they didn't have a simulation program as such. We started with the faculty development program and empowered people to go there to their own institutions and start the program. What we found was, as soon as nurses, especially, they were the ones, nurses and doctors, found it very, very useful to actually participate in them. Once they participated and they were able to see the change they were able to give to their patients, that kind of built the momentum. So that's how the buy-in happened. It happened very hyper local. To actually get the hospital to like support you was like still a little bit of a hit and miss. In terms of institutions such as medical colleges and all that, it is now regulation is available. It is regulated to have a simulation lab and a simulation program in each of the medical colleges for undergraduates, postgraduates. So that is still work in progress. In terms of social media, that has been our lifeline. So we have our WhatsApp, which we have almost all our PediSTARS members are in one or the other groups. There's a constant motivation that goes on in that group, about what challenges we have, how we solve, how each one is doing, lots of pictures being shared. So that's a daily motivation for us. Apart from that, all our activities, we use our social media, all the other platform as well. But for us, what worked was WhatsApp.
Mm-hmm. Yeah, I'm pretty sure it's been used in a lot of countries. So One question I'm having here is from Indonesia, where Leah wants to know any advice, simple way to measure the validity and reliability after you build a pediatric case scenario. So any tips for Leah?
So we haven't formally done that, whether validating or not, but generally our core members, we sit down and frame the scenarios. We normally just give a template. It is very difficult to actually validate it completely because each center needs to have their own, they'll have their own expectations and learning objectives. So I think one size doesn't fit all. So we haven't gone in that route yet.
And to add on, it's also system-based practice. So you have to stick to your system where you practice, but definitely evidence-based practice supports your simulation scenario, and whatever system you're working in is also a secondary thing. Another question I have is tell me something about midwifery simulation in remote and rural regions of India. Any thoughts, anything you have seen or any experiences?
So I think that work is being done by a different agency altogether. I think Japago, and there are a couple of LEDAL companies that have associated and conducting some programs like that, like Help the Baby Breathe. HPB is another program that is going on. So I think it is happening at a different level by different agencies. PediSTARS is right now not involved in that. But yes, that simulation program is available.
So now, what is the way forward for PediSTARS or simulation in India? Where do you see simulation going in India and also in other developing countries and LMICs?
So I think the first thing is we are right now focusing mainly on training and research. The real change has to happen. And we have even worked with the community to bring about that change. I think the real way forward would be to empower as many people as possible to take this up. And then it becomes a simulation culture, So that's what we are looking forward to in years to come.
And I have one more question. There's any resources related to simulation that can be shared? So do you know?
Still haven't heard
place?
about working.
Sure, we'll try and just help out as necessary. So you can reach us out on our email ID and we'll be happy to help out.
So is there any indigenous technology you have experienced? I mean, technology coming out of India on low, medium, or high fidelity simulation, any kind of simulators or other technology available, or it is still being imported from other part of the world? Have you seen any local innovations?
So some local innovations have started. They're all in the early stages. Some of the, I think, Bangalore, the city where I come from, is a hub of all the startups. So a lot of work is going on. Some mannequins have already been created within India and being circulated for most of the nursing, rural medical and nursing colleges. So that is just still going on. Yeah, there are mannequins available. The focus has always been on high tech because it's a bit jazzy to actually use it. But we are propagating everybody to say that think about the learning objectives, think about how you bring about the realism with what available resources you have. So that's what will be our focus, and we'll continue to do that.
This is, as we say, it's all about the technique, a little bit about technology. So now we have to wrap up. We are closing to our time now. And what would be the 3 tips you will give to anyone who wants to start simulation program in LMIC in other countries from your experience?
So the first thing is, don't worry, you're not alone. It's important to just have a start. So start with whatever resources you have. Try to network internally within your communities, within your, build the community within your country, and then do lots of international networking, because help is always available. So that's what I'm going to say.
Thank you. I think those are one of the most important tips for anyone who wants to start the simulation program. Don't worry, have your networking, and keep doing the good work. Thank you, Dr. Thyagarajan, for your wonderful presentation and for being with us today for the Healthcare Simulation Week. And also, we have another presentation lined up today, and our president, Dr. Haru Akuda, will be opening the Healthcare Simulation Week in a couple of hours. So stay tuned, stay with us. Thank you, everyone, for joining us today. Thank you.